This is Create the Next from ProCFO Partners, where every week we explore strategies and ideas for financial management and growth to help today's businesses put their financial picture in context.
Welcome back to Create the Next. I am Chris Ventliff, and I'm joined today by Sam Heller. And Sam, it's great to talk to you. It's great to be with you today, and really nice to meet you. And I'm interested in your unique perspective on the healthcare industry, particularly obviously where financial functions are concerned. But give us just a little bit of background on why this is an area of interest or expertise for you. And I think it's such a dynamic. It covers so much from technology to patient care to innovation to chemistry to pharmaceutical. I mean, it's just huge. Is there a place you like to sort of focus in on, or that you are most sort of expert in when it comes to healthcare?
Yeah, well, my entire career has been in the healthcare provider side. So providing healthcare services. That's what I mean by the provider side. So that's been my whole career. I worked in a hospital setting, a nursing home setting, and most of my career was with a visiting nurse service of New York, which was a home care agency that transformed itself into a Medicaid, Medicare managed care company. So that's been my career. That's been my interest. That's been my passion.
Interesting. Why is that a passion for you, do you think?
Because healthcare to me has been the ability to provide services and provide services to people who are ill and need those services. And I was very lucky in my career to have calls from friends, neighbors, relatives in times of crisis, seeking assistance. And the healthcare field, one of the issues has always been, it's so difficult to navigate the healthcare field when you're in crisis. And not even when you're in crisis, but all the times, but especially when you're in crisis. And to be able to assist people and give them direction and assistance was always something that was a side benefit of my career. So that's why it became a passion, but also just a very fascinating field.
Interesting. So it's interesting that we're talking as we are, as you and I are having this conversation. We're more than 2 years out from the start of the pandemic, and depending on which headlines you're reading, maybe we're settling into some sort of a new normal, as they say. But I bet it's been a pretty crazy couple of years from your perspective. What are some of the unique, challenges isn't even the right word. What are some of the unique transformations that you feel maybe have occurred, particularly from that business or finance function in healthcare? And how about now, as we're moving past, we had a lot of assistance available to all of us, and that has been sunsetting. So are there new challenges or new dynamics that are emerging on the other side of this?
There are new, but there are new dynamics that are very closely related to what has happened in the past and are very similar to other organizations. So let me go through some of those. For example, staffing. Staffing was a major issue for healthcare providers, of course, during COVID, a major struggle because you have to provide services. You cannot say we're closing our doors today because staff have called in sick. You have to figure out ways to provide those services. And we all read about what was going on. But today, post-COVID, again, there are same kinds of challenges that other organizations have. And what does that mean? Right now, we're faced with increasing labor rates. So how do you deal with that? And it's not only salary, finances, expenses. You have to figure out how to meet the needs of your staff, the staff that has learned to focus in different ways, meet different needs, how to meet those needs instead of not using necessarily only financial issues. You have to read, it's a different generation. They're requiring more time with family. They're requiring not as long commutes. So you have to figure out how to meet those needs. So that's a major challenge. Finance issues. We all know inflationary costs of all kinds of service are increasing. So what do you do as a healthcare organization to meet those expenses? You have to start negotiating or talking to your insurance carriers, your managed care firms in terms of how do you work with them to meet the increased expenses that all hospitals are facing. And one of the major things hospitals had, and again, many employers had, but very different, is that there was a large infusion of cash to healthcare providers during COVID. That's going or has gone away. So now you have to develop other revenue sources, and you have to work with the managed care services. You have to increase your value-based purchasing, and value-based purchasing in terms of how do you reduce the cost of care overall, and that helps both the insurance companies and yourself. So those are some of the instances, some of the old things and new things that healthcare providers are faced with.
That you're right. It absolutely parallels so much of what we've talked about elsewhere in Create the Next here. This sense of where are we going from here? The sense of innovation, the sense of diversifying maybe our services or our product portfolio so that we are able to attract and generate new revenue streams. Do you feel like the leadership involved that are making some of these key decisions from where you're sitting and who you're sitting alongside as you're helping make these decisions, are they what's the mood? Are they flat-footed with this? Are they prepared and energized to address these issues? Is everybody so exhausted from what they've been through that we're going to find in 2, 3, 5 years that now we're dealing with kind of a glut of performance where healthcare is concerned, as we are dealing with the impacts of whatever does or doesn't happen right now? What are you finding out there from leadership is really the struggles that they're having?
I think leadership is a little tired, but I think is also energized. We are leaders in the field, and this is a challenge. And challenges are what electrifies management and what provides impetus. So while you might take a pause, you might take a little rest, you're definitely energized by what's going on and trying to figure out how to best transform healthcare to meet the needs of individuals, how to best reduce costs, how to best meet IT challenges. And the healthcare field is, in IT, for example, is behind other industries. And there are the energy in trying to figure out how to catch up, how to use technology to provide healthcare services more efficiently, how to use telehealth, for example. These are things that energize a professional. And so I think my fellow professionals are energized in terms of meeting these challenges.
I love that. I love that attitude and that spirit. Do you find that there's a particular area of the things that you've described that seems to be most, I don't know, maybe the hottest pain point or the most elevated issue? I guess what I'm asking is there one thing consistently that you're seeing or hearing where you think if you could just address this thing, even a few percentage points, you'd find that everything else would start to fall into place? Is there one thing I should start to focus on as I'm a leader?
I have to say there are two things. I can't. So it has to be the staffing issues, which we discussed, and I think the information technology issues that have to still be addressed in the healthcare field. The healthcare field has made strides in that area, but not enough. Healthcare has always been behind. You just walk into a doctor's office. Some of them hand you an iPad, but what do a lot of them still do? It's unbelievable. They still hand you that paper to fill out. And it's the same information when you go to the next doctor that they recommend you go to. And the fact that that's just an example, small example of the technology. So that's, I think, the one area, if I had to, even though staffing is important, the one area that I think healthcare providers still need to figure out, meet, and improve.
This really speaks to the systems and processes part of the FCG flywheel that we use at ProCFO Partners, but also you're sort of part of what you're sharing for me is how interconnected everything is. So a moment ago, you were talking about how emerging talent is really looking for different things. They've got different priorities. They want shorter commutes. Well, how do you bring new talent in? How do you manage that staffing issue when healthcare has traditionally been such a hands-on, in the room sort of a thing? But at the same time, you're saying we need to innovate around telehealth. I mean, everything's connected so that for one thing to succeed at its optimum, this other thing has to be innovated on. And then this other thing, it feels like it's really challenging, but it also feels to the point that you made just a moment ago, if we can wrap our arms around this, I mean, the entire industry could be so much more exciting and vibrant, and technology leading it. It could be such a a center for resolution rather than sort of restlessness as it is now. Do you agree?
Yes, absolutely. As I mentioned before, this is what can energize with this professional to meet these challenges, to bring it all together, to figure out how this all fits in. It's a challenge. It's hard, but it's what energizes us all.
Where do you think the CFO fits in all of this? Obviously, from your unique position, and I'm curious, what does the day-to-day look like for you as you're helping manage this? But what should I be expecting or looking for or asking for from my CFO to help me with this stuff?
Well, the CFO is instrumental in meeting all these challenges. The biggest challenge for CFO and for CEOs, executives, are how do you meet day-to-day revenue and expense targets while also strategically planning financially for the future? Where do you invest? You have to meet day-to-day, but then you have to invest in future. We just, again, spoke about technology. Technology is a major expense. How do you plan for that? How do you invest in it? Where do you put money? While at the same time meeting the challenges of labor cost increases, supply cost increases. And that's where a CFO comes in to try to help executives, give them the information so they can make the business decisions based on the information you're providing to guide you through these difficult times.
Do you have advice for how I can take, so much of what we're talking about is current event, is in this moment. Temporally, it's now, and it also there's a lot of sort of responsive, kind of tactical responsiveness. We need to address this issue with these solutions. Do you have advice for how I can also be thinking bigger, 3 to 5 years out? What sort of goals or strategies should I be planning for that address these things in a more holistic and long-term way? Because, the staffing issues you pointed out, we all need it. We're kind of willing to get anybody in who's willing to help us out. Let's figure it out together. But that's not sustainable. How do I start to think about the future and past these, the stress that we've been under, especially this industry, and into a space of consistent innovation, consistent, staffing, addressing that challenge from a place where it's part of our culture, maybe not necessarily just part of our to-do list or our list of things to address today?
Well, I think stepping back, we all have some sense of where things are going. We all have some sense of where staffing is going, for example. It's going to continue to be difficult on the staffing side. So that's part of the planning process, sort of your vision, and try to project as much as you can the future. But I think there are some things you can project. So for giving some examples, staffing. That staffing is going to be continuing to be difficult. So do you have to think of different models of care in 5 years? Do you partner with insurance companies? Do you try to bring in lower skilled staff and give them the ability, give them the tools, the financial tools, the guidance to develop, so they can go and develop their own skills to meet the skills in the future? And there are similar issues. Again, we've talked about IT. So again, where are we going? We have some sense of where we're going. We know more and more care is going to be provided at the home, whether it's through telehealth or providers. So where do you look to start planning in those directions, knowing where other technology, where can you partner with technology companies? Technology companies are looking into the healthcare space. So where can you partner with them to meet the needs of people who want to stay home, who don't want to travel, who it's much easier to provide care? Or does it make more sense to go into a doctor's visit? Out in Florida, the doctor, when they schedule you to come back after you do a lab test, they schedule you to come back in the office. Why? Well, they could bill for it. But the other thing is use technology. Let the people stay home. Do telehealth. So all these things, yes, you can project, I think, and work together with the partners that I've mentioned.
I love that idea, leveraging the expertise of others to help sort of widen your own net or branches of expertise. And you mentioned something that I think really hits on, from a patient's perspective anyway, a key criticism or frustration, which is inefficiency. And I feel like if there's a through point through some of what I'm hearing you say, if we could understand the profitability of improved efficiency, we may make different decisions for the future, and we may make different decisions about our staffing and about our care and about our technologies and everything. Do you think that that is one area that needs, renewed vigor around problem solving? I know that it's on everybody's minds, but do you feel like that's an area of focus for healthcare organizations?
I think that's always been a challenge to healthcare organizations because here the major difference between healthcare and other industries is when we as patients go for services, we look to our insurance company. What does insurance cover? And if insurance covers your visit to the doctor, your visit to the hospital, you don't care what it costs. You don't care what it costs. So that is the difference between healthcare and other fields. But you do have to continue. Healthcare providers therefore have to manage within that, have to figure out ways to work with insurance companies to figure out where the profitability should be, where it should come from, and look at, again, as I mentioned before, the total cost of providing care. So with a hospital, for example, the patient comes in, yes, you got to charge certain services. But what happens when the patient leaves the hospital? Will they have the proper services so they do not come back to the hospital after being home? With their incentive might be to discharge them early. How do you continue to provide services? How do you coordinate with the physicians? How do you coordinate with home care? How do you coordinate with nursing homes? That's where the industry has to look at from a profitability perspective and work with insurance companies together.
So many interesting dynamics, as you point out, with the relationship with insurance companies and so many other ancillary, influencers to what's going on from the business perspective in healthcare, but also the patient's experience and how all of that integrates into kind of the business model, the revenue model. Sam Heller from ProCFO Partners, fascinating stuff. I think if you're out there, you're a listener, and you're a leader in healthcare who's struggling with any of this stuff, give us a call. Sam is the guy to talk to about a lot of this stuff. Sam, it's been great to talk to you. I can't wait to have you back and dig into some of these things in more detail. Fascinating conversation and industry, and it seems like we're just on the edge of it.
Thanks for watching, and a special thanks to our subscribers. Consider becoming one today. Visit ProCFOPartners.com for more strategies and ideas for financial management and growth to help you put your business's financial picture in context.